This video is going to go over how to set up an EVD. So a lot of times patients will be coming back from the OR with these, or sometimes they'll be placed at your bedside, but the process of setting it up should be the same. Supplies that you're going to need a separate IV pole to place your EVD leveler on. The levelers can be found in the clean utility rooms. You're then going to need a transducer, a site scrub, a flush, some red caps, and some do not inject tape. So first thing you're going to do is prime your transducer. This portion of the tubing that you use for your art line, you do not need for your EVD. So you can just go ahead, disconnect that, toss it over to the side. You're then going to take the cap that's up by the pressure monitor cable, remove that, scrub the site, and you're going to connect your saline flush. You're then going to turn your stopcock, open the first port, pull on your yellow string and flush through, and replace that with a red cap. Once again, these white caps have a hole in them, so you want to make sure that you're always replacing with a red cap. You'll then turn your stopcock back off to the port, pull your yellow string, prime through the end, replace that with a red cap, and then you can remove your saline flush and put a third red cap on the end there. Now your transducer is ready to go. When your patient arrives back with their EVD, everything is going to be clamped. So you're clamped here, closest to the patient. You're then going to take your EVD and you're going to place it on your leveler. The level is going to be decided by the neurosurgeon, so you should have an order in your Cardex saying where to level your EVD at. We're going to say that this surgeon wants this patient's EVD leveled at 5 above the EAM. You're then going to sit this inside your leveler, and you're going to bring this down until the flange is sitting at 5 right here, and then screw that into place. So you want to make sure that this portion of the EVD is sitting at the level 5, not this portion up here. So once you're at the correct level, you're then going to take this portion of the EVD, pop this in here, and this is going to be where I'm going to connect my transducer. So I'm now going to take a scrubby, scrub this, and I'm going to connect my transducer here. This portion will then connect to the monitor. At this point, I'm now going to make sure that I am level with my patient. So I'm going to use my laser back here. First, I want to make sure that the bubble is within the middle of the laser. And then I'm going to turn my laser on. We are going to be measuring to the patient's EAM. So I'm going to take this and get my red dot level with the patient's EAM. Once level, I'll secure that. And now I can open up my ports. So I'm going to turn this stopcock to there. And I'm going to turn this stopcock here. So now my patient is open, unclamped, and draining.